Welcome to the One Mission DMD podcast, the show where we not only aim to motivate and inspire, but help you get into dental school, get out, and live the dream the way you want to. Here's your host, Teham Saud.
Hello, everyone, and welcome back to another One Mission DMD podcast, your complete roadmap for before, during, and after dental school. My name is Teham Saud, and today we have two very special guests, Saif and Lana, who both graduated from Midwestern University in the class of 2021. They later got married and moved down to Houston, Texas, where they're now involved in private practice. So in today's episode, it's actually going to be a new segment termed The Real World. A new segment where we focus on things that dental school doesn't really prepare you for, and it's things that new dentists should be aware of because you will experience this at some point in your career, especially in the very beginning. So without further ado, Saif, Lana, thank you so much for being a part of this episode and agreeing to be on this new segment.
Thank you so much for having us. I just want to start off by saying it's an honor to be your first repeat guest.
Yes, absolutely. Yeah, Saif is not foreign to the One Mission DMD podcast.
No, I'm a big fan. I'm happy that I'm back, and I'm even more happy that I'm with my wife.
Yes, I'm very honored to be here. I'm a first-time guest and first time being on a podcast, so I'm excited.
We're excited to talk dentistry, and I think it's a great concept, the new segment that you started, and I think we have a lot of things that we can share for sure.
Right, and the reason why I think you guys are perfect for this episode is because I reached out to you guys first regarding my own experience that I had that I was not ready for, and I just needed to talk to someone about. So who better than you guys to actually have on this first segment to talk about stuff like this? So thanks. So just briefly kind of give us a little intro in terms of where you guys are at right now, where you all went.
Sure. So we have been practicing for about a year as full-time dentists. And so we've actually had quite a bit of a learning curve over the last 365 days or so. And we just learned a lot. And like you said, we graduated in 2021. And yeah, I mean, as far as like our background as well with each other, we met in dental school back in 2017 and obviously went through all the trials and tribulations of dental school together. Mm-hmm. And now here we are.
Yeah. A little bit of my background before dental school. I went to Loyola, shout out Chi-Town, and I graduated with a degree in psychology. So that's a little tip. You don't necessarily have to, major in biology or anything.
Right.
So yeah, and I decided I wanted to go to dental school, and it was like 5 minutes from my house.
Awesome. So when did you guys get married? Like after dental school immediately or like during what?
Yeah, pretty much right after. September 2021, we graduated in May 2021. So like half a year. I moved back basically right after we graduated. So June of 2021. And Lana's from Chicago, so she stayed there a little bit longer for, family reasons. And obviously wanted to slowly transition to moving to a new city. So she came about, I think it was like February 2022. Yeah. So it took a little bit longer, but now we're both here and going through all types of dental things and all types of marriage things, and it's been pretty good.
Lana, I know Chicago's totally different. So how's your transition been in Houston?
I think it's not as different as a lot of people think. They're both major cities, so from that aspect, it's pretty similar. A lot of good food, a lot of everyone's really nice. I haven't experienced much differences in that respect. I
think Saif would argue that the food is. Where is it better, Saif?
Why are you starting this here? This is supposed to be a peaceful dental discussion. Yeah.
Big controversy there. Listen, there's diverse food in both places.
That is very
true. I can be factual in saying that. And yeah, I mean, it was a big transition because I've never lived anywhere but Chicago my whole life. So yeah, I actually even did work a little bit in corporate dentistry after graduating and before moving here. So I have that experience. But no, it's been good. And, it's been a pretty flawless transition, I would say, considering. And I get to go back as often as possible because, it's a really easy flight. So it's
right. Well, we're just going to jump in. So basically what this episode is, like we were saying, that this is the segment dedicated for new dentists that need to be wary about things that, school isn't preparing them for. And what we're going to do is I'm going to just kind of get into how my experiences, which led to this episode. So, I'm just on my rotation, and in fourth year, at our school, we have to go to different clinics. Every 4 weeks, we're at a clinic, and then every 4 weeks, we're back at school. So I was at a rotation, And, everything's going well. It's like into my third week, and we were able to see patients. I did a couple root canals. I was able to do some extractions. So I was really excited because, it's faster than school. No one likes the slow paced environment of school, right? So, it's just another day. A patient comes in and they need to get an extraction. I think it was like number 14 or something. So, they sign all the consent forms and everything. We get them prepped. We numb them up. We wait 10, 12 minutes before we do anything just to make sure they're nice and comfortable. And we start like any other normal extraction. You're starting with the periosteal. You're elevating to get good mobility. And that's the point where you grab the forceps, right? So she's doing well. We're periodically asking her, is everything okay? And up until the moment when I grabbed the forceps was when I could tell the patient was getting uneasy. And they were pretty much explaining how, they weren't feeling comfortable. I could see them crying. So at that point, I just put the forceps down. I'm like, okay, give me a second. I'm going to give you some more anesthetic. We're going to make sure you're comfortable. Again, I waited for another 5 to 10 minutes really well to make sure everything's like good to go. And we start with the forceps again. And I'm barely applying any pressure. Like, you have to squeeze onto it, buccal and lingually to make sure you get a good hold of it. And I'm telling you guys this, like, I've been doing this longer than you guys, but I'm not.
Everybody has different experiences.
Yeah. So she just started like profusely crying. Like I could see tears falling off and hitting the floor. Like that's how much she was crying. And I'm like, okay, give me a second. I'm going to stop right now. I'll be right back. So I go to my directors at that rotation and I'm telling them, look, I know she's numb because after I gave her the second time, I'm poking the Explorer into the area and making sure that she's not feeling anything. And she said, yeah, I can't feel anything. But when I grabbed the forceps, she just, is not having it. So they came, they also verified, that she's numb with the perio probe and the Explorer. And they also got the forceps and she, again, same response. So that's when the directors were telling me that this is where you have to refer the patient. Like, this is the indication for sedation to be indicated for the patient, and that's probably what's best for them. So I go and tell them that. And the assistant, I can see, is visibly frustrated by this whole situation. And so we tell the patient, and she's initially frustrated too, but then she understands, like, no, you guys, you're right. I probably need this or whatever. We'll do this some different way. So the patient's gone now. And then the assistant comes to me, well, I go to her actually, and I tell her, like, look, I can see that you were upset. And I just want to let you know, like, we did what we could. And then she interrupts me and told me that, well, she can't afford an oral surgeon. And I'm like, okay, I didn't know that. So, but then at the same time, I told him, like, look, like, even if she can't afford an oral surgeon, I can't do something if the patient isn't willing for me to do it. For sure. So, and then that's when I went back to my directors again. Like, I was just like kind of going back and forth, in and out. I just wanted to make sure I was doing things right. And the doctors are like, man, this is what you signed up for. You're going to be looked at badly if you take the tooth out and if you leave it in. Yeah. So if you take it out, the patient might be like, yeah, this dentist is like terrible. They don't stop. They just don't even ask if you're doing okay. If you're in pain, they're just going to take it out. Don't go to them. Yeah. And then while the staff might be like, they don't care about getting the patient out of pain, they're just, trying to sit and just get paid without doing work and stuff like that. So that was a huge wake-up call for me, and I never even realized it, and schools don't really teach that. So I know you guys had some interesting points to talk about this, so jump in.
So anytime a situation like this happens, and it happens to all dentists, not even first-year dentists, or dentists, period, sometimes it feels like you're doing something wrong, and you start to doubt yourself because the patient's in the chair crying or screaming at times, and in your mind, you're like, I'm following everything that I've learned, and I know I have the best intentions in mind. So the reaction that I'm getting from the patient is not proportional to what I'm putting into it. So you're just kind of like taken aback a little bit, and you're like, "What? I'm trying to help. I promise I'm not trying to cause issues." Mm-hmm. You're also not trying to upset the assistant in your case, right, or your boss or whomever. So it's jarring when that happens, for sure. And you just got to remember, if you're in this position, just take a step back, relax, remember that you are doing the right thing. You're trying to help somebody. So, get over that initial shock or that trauma or whatever you want to call it. Now, specifically with this case, it sounds like it's what we call a hot tooth or an angry tooth. I've heard different terms for it, where someone comes in with pain specifically. Sometimes people come in with a decayed tooth, but they don't have pain. In this case, it was someone who came in with pain. And sometimes people have these instances where no matter how much anesthetic you give them, they're still just the second you put any pressure, it's just like a shooting pain that goes all the way up to their, ear or temple or whatever. And, it's just angry bacteria. That's what you got to tell the patients. The bacteria is just really angry. No matter what I do, it's just not calming down. So what I've learned in my experience, and I think, Lana, you've gone through similar things, is at that point, even if you've already started working and maybe you're even an hour into this and you just can't get past that hurdle. You have to do the smart patient management thing and just stop, talk to the patient, tell them what's going on. I'm doing everything I can for you, but it seems like you're in a lot of pain. So what we're going to do is we're going to prescribe some medications, some antibiotics, some painkillers, and have you come back so that, the bacteria level can go down, the pain can go down, and that you'll be more comfortable in the chair. And, I've had a few cases like this and patients have come back and they've been able to sit through the actual treatment. So it's something that, like the whole concept of the show, they don't really teach you that in school. I'm sure that some students have learned it in their experiences, but generally speaking, I didn't know that that's a strategy to do where you prescribe medication and have them come back.
They never really say that in school.
No, they don't.
Only the specialists bring it up.
Yeah.
But like your general faculty, they won't ever mention that.
Yeah, did they tell you by chance in school?
Yeah, no, not at all. I mean, usually in that type of case, like your faculty said, you would have referred it because it's just too difficult, but in practice, like you can't do that to every like angry patient or hot tooth that you see because you're not going to do any work. Like it happens a lot more often than people think. And it's definitely jarring the first time. And even like today with, we had our like oral surgeon that I was telling you about, he had a patient in the chair that was screaming, crying, and she's very numb and she's even under IV sedation. But like he kind of, in that case, he had to like keep going. But in the real world, you kind of have to patient management and see what other types of things you can do, whether it's prescribe and have them come back or even try different like anesthesia techniques. Because sometimes with patients, in patient management, it's like you have to show them that you're doing more. Like, yes, the patient's feeling numb, but maybe just the act of even showing her that you're numbing her more, that it has the placebo effect of like, oh, okay, I'm feeling more numb. And
obviously a safe amount.
Yeah.
You're not just like plunging them with too much.
And trying maybe different types, like different injections, like a PDL injection, or if the tooth is decayed enough and you can like see the pulp, like giving an intrapulpal and letting the patient know like this is going to hurt a lot at first, but then you'll feel a lot of relief. So just taking things step by step, trying new things, like that's kind of the onus is on you at that point in the real world to see what you have to do because there are no clinical faculty, and it's whether you're going to get, you're going to take that tooth out and get the production or, just like what you want to do.
And I can confirm this most likely was a hot tooth, like Saif just said, because this tooth was like, there was barely any crown left. It was severely decayed and it was not previously treated like RCT. Like I knew that when Saif said that at first, when we talked about this before we started, like I was pretty sure that's exactly what it was. So, and that palatal root is just huge. So it's like, you can numb as much as you want, but if there's so much like just active infection with acidic environment, it's not good for anesthesia. So, yeah.
Like what we mentioned before, it seems to be the pressure more than anything that hurts the patient.
That's right.
So especially with a palatal root, when you're trying to like elevate a big root like that, the second you even like turn your wrist a little bit, that's when they start to like jump out of the chair. So that you kind of know that's the indicator right there that if you're putting the slightest bit of motion into like elevating even, and they're like jumping out of the chair, save yourself some time, talk to the patient, but just let them know we should reschedule this when you can be more comfortable.
Yeah. And another thing, like another tip, again, going into like my psychology background, but I mean, it is a lot of like when patients see a forceps, like that just kind of, it looks like pliers, like it looks scary, so just kind of letting them know like it's almost out, you're doing great, just like talking them through things, like it'll make them see that it's not as scary as it seems, because anytime, like even in school too, when patients would come in and they would see all of the instruments laid out for an extraction, they'd be like, oh man, what are you guys going to do to me, type of thing. So it's a lot of psychology too, to just like talk the patient through things and let them know, like,
And, you know, ever since that day, because I think what you're saying is absolutely right. Like when the patient saw that forceps, I think that's what really got to him. Yeah. And when they just knew that that's what was in their mouth, like I think she really felt uneasy, which granted is natural. Anyone would feel that, right? But that's why, like, after that, I got way more conscientious about when I finished with one, like if I finished with the elevator and I need to get the forceps, I like go behind the patient now. I'm like, can I get the, I try not to say forceps now too. So it's like, they know what I need and they just give it to me behind the patient. Then I just go in. So I think I learned that actually from a lot of the directors doing that. I'm like, I think I need to continue with this thing. So
anesthetic too, that also, like, you hide the needle, you don't show them, like, that's also,
you don't say the word needle,
you don't say the word needle, shot, or this is gonna hurt.
You know, something else that I do, and I think some dentists might actually disagree with this, but during a surgical extraction, if things are, you know, taking longer or the patient's getting restless and I'm like sectioning a tooth, sometimes I'll take an x-ray and I'll for my own knowledge so I can see what I'm looking at. But if I can judge that the patient is going to be okay if I show them an x-ray, then I'll show it to them and say, look, we're working really hard here. This is what it looks like right now. I have to work in this area, free this up. I have to do this. So they know that I'm communicating. Mm-hmm. They know that I care. They know that I'm not just like jackhammering, you know, using a giant instrument or whatever, an instrument that, you know, has a motor, like a handpiece or anything like that, that I'm actually doing something with a purpose. Mm-hmm. So in my experience, patients have appreciated it. No one's ever looked at the x-ray and been like scarred and this is what you're doing to me. You know what I mean?
So you're saying you took an x-ray after you sectioned the tooth? Yeah. Oh, wow.
I would really recommend it. If your office is capable, they have a nomad or whatever, because you want to know that you're sectioning in the right area for sure. So definitely take an x-ray anytime you're unsure. Yeah.
So yeah, like after going through that, it really taught me to look at things from every angle. Like before, I'm just like, okay, I'm there, I'm on rotation, I'm just going to do it. And just, that's it. But you have to take into account what the patient's feeling, what the assistant working with you is feeling, what the manager's thinking, knowing that this is probably going to be referred out. Like I felt like I did something wrong. Like I went to my directors and I told them that, hey, I'm not able to do this because the patient's not comfortable. And the director looked at me, he's like, it's not your fault. And I needed to hear that. And you guys told me that too. And I needed that because I felt like I wasn't doing my job. But it's not that it's my fault or the patient's fault. It's just that if it's not working, then you can't force it. Because if you force it, you're going to regret that later. And the patient's going to hate you and you're not going to have a good time either. So I think it was just a huge learning experience. And if anything, like, yeah, I did a lot of procedures at the rotation, but this was probably the most noteworthy thing that I'm going to be referring back to for probably as long as I'm practicing, because this stuff is not going to be the only time that I'll see it. I'm sure it's going to happen more and more, and as I'm sure it's happened with you guys too.
I mean, you're mostly going to remember things that didn't go right, you know?
Yeah.
So you can do like 30 fillings and you don't have to even remember them ever again. But the first time you get an incident like this, you're gonna remember it.
Remember how it made you feel.
And what you learned from it.
For sure.
Yeah.
All right, Saif. So share with us your experience that you'd like to kind of shed some light on.
Sure. So my case study, your case story, whatever you want to call it, is kind of similar to yours. It's an extraction-based story. And it happened pretty recently, about a week ago, maybe 2 weeks ago. And before I kind of get into the details, the moral of it all is you really have to take it upon yourself to do your due diligence because your license is on the line. So what happened in this case was a patient came in on a limited exam and he, I believe, must be in his 60s, and he had pain on number 11 and number 12 and both severely decayed, broken down teeth, and they need extractions. So on his medical history, it said high blood pressure, it said diabetes, which is a pretty common duo. You see that in a lot of people. But I talked to him, and most patients with diabetes, they don't really check their blood sugar. If your office has a glucometer, definitely use it. But the best you can really do is talk to them and really get an idea for what their baseline levels are. So, for example, ask them, have you had any, first ask them, what was your last reading? If they do know it, that's great. And then ask them, have you ever had any like medical emergencies from like low blood sugar or high blood pressure or anything like that? So I went through all those questions, and he, you know, really made it seem like, everything was good. The blood pressure was good. Diabetes was good. And, we checked the blood pressure that day and it was normal. So all seemed well. It's like, all right, we can take these teeth out today. Let's just get it done. And then I go in the room. I'm about to numb up the patient, and something came over me to ask an additional question. I don't remember exactly what it was, but what came over me, that is. But I decided to ask him, what about medications? Because I looked at his medication list, but it was very short. And I was like, this seems like all stuff that is fine. It's, no adverse things here. And things still seemed okay. And then in the end, I asked him, what about like blood thinners or things like that? And then I was, like Coumadin and what are the other ones?
Like Plavix or clopidogrel.
Warfarin.
Okay. Y'all still remember from boards.
Okay.
He said no to all of those. I was like, all right, cool. We are like right at the start line. We can do this. We can start the race. And then he goes, oh, by the way, I have been taking aspirin once a day for 30 years.
Of course.
Casually just like snuck that in.
Yeah.
Now, a lot of dentists don't really consider aspirin like a true blood thinner. Like, yes, it is a blood thinner, but not where you can't do treatment.
Mm-hmm.
If someone's been taking it once a day for 30 years, my own philosophy is that I'm not doing anything until I'm cleared to do so medically.
Mm-hmm.
So, was it, briefly embarrassing that I had to seat the patient back up and be like, okay, listen, we got to talk. Like, yes, you have to overcome that, right? And you have to say, this is for your safety here. Listen, we're not actually going to move forward with the extractions today. And here's why. Aspirin is a blood thinner. You've been taking it once a day. So, taking out teeth could end up being dangerous. You could just have continuous bleeding. And he actually, if you're very honest and upfront with patients, most of the time they're going to be appreciative. And he was one of those patients. And he actually told me, oh yeah, I've had teeth taken out before and the bleeding just didn't stop for days.
Well, there you go.
And I was like, yeah, that's not normal. Things were fine still, even though he bled for a few days. But every case is different. Maybe when I did the extractions, things could have gone south. Mm-hmm. So I decided med clearance time, fill it out. And also, this is a side tip, an extra tip, I guess, for new dentists. When you fill out a med clearance, most physicians don't have time.
Yeah, they don't even care.
No. Exactly. They're like at the most just like a check mark here and there. You have to be specific in what you're saying. Say like they have high blood pressure, diabetes, and put a giant star and say, by the way, patient's taking aspirin. What do I do? What does the patient do? So the story actually goes on a little bit. It doesn't stop there. So gave the medical clearance to the patient. He took it, and the days have gone by. He's come back to the clinic, and just to hand off the medical clearance, the filled out medical clearance. I was in the office. The receptionist brought it over, and she told me that the med clearance has been filled out. You want to take a look at it? I take a look at it, and as I mentioned, it's barely filled out. Just certain things are filled out that I'm not interested in. I need to know what to do regarding aspirin. So at this point, I consider just go ahead and do the treatment because you got the clearance, right? And a lot of people would do that. And sometimes I wouldn't even blame them. You got the clearance, you did your due diligence. I took it a step further because I didn't feel comfortable. And I asked the staff member, please, can you call the office and talk to the doctor or the nurse or whomever? So we did that, and she came back to me and told me, yeah, so the doctor definitively said, for sure, you're going to want to stop the aspirin 5 days before. For sure. And they're not even like, yeah, you can if you want. It's like, this is important. Mm-hmm. And I was like, it would have been nice if you mentioned it in the med clearance. But I understand, he's probably busy. He or she's probably busy. So point is, in a small instance like this, just 2 teeth that need to come out. This is your license on the line. You want to do things to protect yourself. You want to do things to protect the patient, keep them safe. You don't want them going home bleeding continuously. Mm-hmm. So make sure you do the med clearance. Make sure the med clearance is filled out properly. If it is not filled out properly, take the extra time to call, get the information you need. And then once you have the approval, then you're good. You don't have to stress out. Just get to work. Do dentistry at that point. Yeah. So that's kind of I thought it was a good contribution to today's podcast. It's kind of, they don't really teach you that at school. They teach you about med clearances, but they don't teach you about, well, if something still isn't right, what do you do then?
Right.
And you just got to go ahead and do it.
Yeah, for sure. I mean, just going off of like the whole med clearance thing, I usually put like, patient is taking aspirin please indicate if they need to stop the aspirin and how long before they need to stop, when they can start taking it again. Like, you literally have to spell it out for them. And then again, at that point, if they don't, then you call, but it's like, you have to, write everything down. And kind of going off of that, I too also had a patient that said he had diabetes, high blood pressure, same thing. And he said that he was taking 4 medications for diabetes. And I was like, that's all he said. And he's like, that was what it said in the ministry. And I was like, okay, that's weird. So I asked the patient, and he said, yeah, metformin and other things I can't remember. And I'm like, okay. So I asked the assistant to make sure that he tells you like all of the medications and the names. And she comes back, she's like, yeah, he's taking clopidogrel. And I'm like, okay, well, that's a blood thinner and we need a med clearance. I was, again, also very close to like numbing up the patient. This was like a number 10 tiny root tip. Like, it probably would have been fine, but still, you don't know. Yeah. And she was like, yeah, he didn't even remember the full name of it. He had to like write it down. And I'm like, okay. So sometimes you do have to kind of take that extra step and like make sure you have all of the information, especially with things like blood thinners or like, like aspirin, things like that.
Yeah, actually, one of the directors at the clinic I'm rotating at right now said this today, actually. He said, like, I had a patient before and they needed 2 extractions and they're on blood thinners. I forgot which one at the time that he said, but, he told the patient, no, I can't do this because we need to get you, medically cleared. We need to get a med consult, and just like what you guys were just saying. And then the patient, this is what the patient said. They said, no, it's okay. Like, I can sign a paper that says even if something happens, like, I'm not going to press charges or anything like that. And then the dentist just like, he told me, he just stayed quiet and like listened to it. And he's like, well, what if you die and your family sues me? Then what? And so I'm like, then he's like, yeah, okay, all right, we'll figure something out. So it's serious stuff. Like you said, it's your license on the line, what you worked for, and it's not worth it. And it's not worth for the patient, obviously, number one, but it's not worth you to have to go through that. So
if you talk to them about it and tell them why you're not doing it today, like, they'll understand.
Exactly. Yeah, more often than not. And if they don't, those are like, problem patients, and you just kind of realize that you're dealing with someone who might not be listening to logic, and then you don't blame yourself. You just you stick to your principles.
Yeah,
exactly.
For sure.
Okay, so before we wrap up, Saif and Lana, would you have any closing remarks, something you'd really want people to know if they're just about to graduate before starting a job?
Well, yeah, I feel like there's a huge learning curve. You go from seeing 2 to maybe 3 patients in a day, and then you go to see like 15 to like 35 patients in a day. So that's like a huge jump. But you do, obviously, you get used to it, and it's just like you're kind of thrown into it, but you can do it. It's possible. We both have done it, and you get used to it very quickly. You will just learn to get a lot faster, and you learn, the right questions to ask and how to be more efficient. So it's hard, but you're able to do it.
Yeah. And then, and sometimes even like 20, 25, 30, 35 patients a day, depending on where you work.
Yeah.
She did say 30.
That's true.
I said
15 to 35.
Well, I think I said 15 to 20.
If you want to be like
Sorry.
specific.
I heard 15 to 20. I'm like, you're underselling it. Sometimes you're seeing like 30 people.
That's okay. I got you. I heard you. Yeah.
Those days are tough. The many patients. But like you said, it's all about just getting more efficient and, time management, all that stuff. And it comes with practice. I think there's no cheat code, really. It just takes time.
Just practice.
And you'll get it. Just takes experience. Every single day that you go in, you'll get a little bit better. Well, actually, to be truthful, every single day you'll go in, you'll get a little bit better, and then some days you'll get worse. It's not a linear thing or even like a exponential thing.
It's cyclical.
It's cyclical. But it's true. Like you feel like some days are like 1 step forward, 2 steps back.
For sure.
And that's also okay. Just keep every single day is different. Mm-hmm. So as far as your just approach to becoming a new dentist and like experiencing things, it's all about just learning every day. Try writing things down and learning from it. Mm-hmm. And every single day is different. Some days you'll have like a terrible day, and the next day is not so bad. So you just have to remember that things don't usually just bleed over into the next day.
Yeah.
No, that's what I would have to say just about becoming a new dentist. as far as this podcast, this segment, I think it's a really good one. You plan on making this like a series?
Yeah, man. I think what we talked about was really cool. And I think anyone can benefit from it, kind of getting into it. So yeah, I think we're going to continue with this and just bring in new people, new topics, and maybe have you guys come back if you're down. So yeah, absolutely.
Like a three-peat maybe? But yeah, it's a great concept. And I think the biggest thing about actually your channel in general that I appreciate the most is helping people with no ego. That's the biggest thing that I like. It's not here to flex on people that what you're doing. It's like, how can I help others? Mm-hmm. That's the thing that draws me the most to it. And that's why I enjoy, being on a podcast. So keep doing it. We're going to keep watching. And if you need us back on here again,
we'll gladly do it.
We're down.
I appreciate it, man. It means a lot. It's, this channel was initially made for helping people like navigate through dental school. And now that I'm almost done, I'm trying to expand on that. And that's what the goal is. And, just talking to people that are ahead of the game compared to where you're at, which is exactly what this secondary goal of this channel was, for me to learn from people. And hey, whoever's willing to learn along with me, join the ride, man. Just come through. We're going to continue to have a lot of segments like this. Thanks again, Saif. Thanks again, Lana, for being a part of this episode. It was a lot of fun. We're definitely going to do this again, and catch you guys next time. Take care.